What's a normal time frame? Or is it dependent on the child?
It's just dependent upon the mom and the baby. Statistically, we wean babies earlier than any other country, but it would be nice if we saw babies nursing to 12 months. Generally speaking, we see 6, I think, usually 3 to 6.
Yeah, the recommendation is a minimum of 1 to 2 years.
Right.
In 2 years, I know it's probably more a stigmatism for the public if they're out in public, because at 2 years old, the babies are pretty much self-sufficient and know exactly what they want. And I think the public is more uncomfortable than we are.
Sure.
And I think even with young babies, I think we still have moms that are very stressed about being in public places.
Right.
And so that is often a barrier. Like if I talk with moms, they'll say, that feels way too much for me,
to nurse in public,
to nurse in public, or to, what if I'm out at the grocery store and, my baby needs to nurse, or, so that is one thing that we'll hear a lot of times moms say, and just teaching them that you can do it in a very modest way, and that you can nurse, that as you get better at it, you can do that without, there's places you can go if you need to do that, or so.
I know I've rarely seen women be not discreet when they're nursing.
That's true.
All the women I've ever seen are very discreet, they're covered, and so the public says, well, I know what you're doing.
Well, often they don't.
They probably don't.
It's hard to tell.
It is hard to tell.
We talk with moms too about, having slings and wearing their babies, and so if they have, if they're doing that too, a lot of times they can nurse very discreetly, and people won't notice. So we do talk, that does come up. I've had that come up quite a bit. Moms talk to me about, well, how do I, pull this off without offending someone out there in the community, while I'm trying to feed my baby.
I think we're always going to offend somebody. Somebody's not going to believe in it, and that's unfortunate, because I think it is really a beneficial to the child. What about mothers that are on medications? We've got so many different medications going on nowadays, and many, you've got your people that are maybe bipolar, but you've got a whole gamut of medications that people are taking. Would that be a doctor, or would you be able to talk to them about the medications that they're on?
They can call their doctor's office. They can call us. The book we use, the reference book we use, is called Medications in Mother's Milk by Dr. Thomas Hale.
Okay.
He collates all the research and updates it every year with the most recent research on all the new drugs. And he looks at dosage and how much passes through the milk. Some of it's based on time, like how long it's been since you've taken the medication, or how long it stays in your body.
Okay.
And so it's very specific. We can look up specific drugs and tell you exactly, how long you have to wait for the medication to clear. But most medications are safe. The benefits of breastfeeding so far outweigh any risk that you would get from most of the medications that a normal person would take. The only things we really know you have to stay away from are any anti-cancer medications, radioactive medications, and
chemotherapy drugs.
And illegal drugs, of course.
I always recommend to clients that are on a medication to be specific about that medication with their physician, and to look it up specific to breast milk. In the Medications in Mother's Milk book. It's really the only book that gives an accurate description about the effects of the medication on the milk. And in that we have a variety of medications. We can be prescribed a different medication that may be safer. So being willing to do some homework on that. So, most thyroid medications or insulin-dependent mothers, those types of things, they're very safe, but to be specific with your care provider about the medication, and if it does seem to be contradicted with breastfeeding, to be prescribed something else that would be less dangerous.
Well, I know I've heard the pros and cons as far as even Tylenol, acetaminophen, regarding the pass-through to the child, and I've never heard anything for a couple of years more about it, but I know that doctors are always paying attention to even those type of drugs. So we're not talking about just prescription medications. We're also talking cold medication.
But if it's a normal medication you'd give to a child anyway when they're sick, they'll get way less in amount in the breast milk than they would by just taking it.
Well, it's important to remember that lactation is a separate process than pregnancy. So the same drugs and behaviors that we're concerned with in pregnancy do not exist as extreme in lactation, because pregnancy, everything that the mother consumes goes through her bloodstream to an immature system of a child whose kidneys and livers are immature. And so as the child gets older and bigger and its liver and kidneys are more developed, and also then the medications and substances pass through the mom's body, not through her bloodstream, less is happening to the baby. So it's really important to understand the process.
Well, and that clarification helps, because I'm sure you know, they panic you all through pregnancy, and then you worry about, is it safe to take these
It's a very
drugs?
different experience.
And I think I've seen somewhere, we're not the only ones that offer breastfeeding counseling or classes, are we, at the health department?
There's the Leche League. They have a class once a month at the library.
Okay, so there are some other avenues, and of course their providers will be able to tell them where they can get some assistance from.
Sure.
Any other comments that you might want to add?
The WIC office is probably the largest group of people that are providing breastfeeding help in the community outside of the hospital that staffs some lactation support. So for those women that are on WIC, it's a very fortunate experience for them, because they have hands-on help immediately at the phone call.
Well, that's great.
And we will help other people if we can. Our classes are free and open to the public, so anyone can come up and take our breastfeeding classes. And they can call on the phone and we'll answer their questions. We won't go to their home, but we can answer questions and definitely help them.
Okay. Well, and I'm sure there's a lot of women, it's just the lack of education that goes with it, because it's not the easiest thing to do, and we'd be silly to say it was.
It's just like anything else. You have to learn how to do it.
Sure. And as long as the women understand that, that's great. Well, we're going to wrap up this discussion by showing a video by Dr. Jack Newman. It's called A Guide to Breastfeeding. And Cindy, what's your phone number that they can contact you at?
239-5260.
Amy?
I'm at the same number.
Me too.
We'll give it all to
The same number.
Cindy's phone number.
Cindy routes most of our referrals.
And encourage all women to take a look and think about making the right choice. And breastfeeding may not be for them, but we really would like to strongly encourage it.
Absolutely.
Thank you, ladies, for your participation today.
Thanks for having us.
Yeah.
And we will see you next month.
Breastfeeding is natural. Though breastfeeding should almost always be easy, the fact that 2 or 3 generations of mothers have breastfed very little, and the fact that most health professionals have had no practical training in helping mothers get started right, has resulted in breastfeeding becoming difficult for too many mothers. This video helps mothers understand the techniques and the importance of breastfeeding by cutting through some of the contradictory information that often makes breastfeeding so confusing and difficult.